What is one of the biggest growing demographics of Botox users? Grab your husbands, boyfriends, brothers, and even dads. As we aren't talking about Botox, we're talking about Brotox on this episode of Follow Your Beauty. I'm Dr. John Mendelsohn, Medical Director of the Advanced Cosmetic Surgery and Laser Center. Stay tuned later in the show for Julie, who's going to tell us a little bit about what's in and what's out in the world of plastic surgery. Before we get started, I'd like to introduce to our show Josh. Josh, welcome.
Hello.
Thanks for being here. Appreciate you coming in.
Yes.
So I was trying to figure out how long we've known each other, and I think it was 15 years plus.
It was 2001.
Oh, well, then I'm bad with math. Was it 2001?
Yeah.
Okay.
I had just turned 21.
Okay.
Mm-hmm.
All right. So
yes. You were my birthday gift.
Okay. So let's talk about that. Tell me what. So 21. What were you seeking? Why'd you find us?
I'm gonna claim it. I was a pioneer of the big lips.
Okay.
I wanted big lips, and being in cosmetics, I was just constantly focused on that, and I found you, and came to you for that. It was my birthday gift to myself.
Okay, well that's a nice birthday
gift.
To
get some lip injections.
How did you know back at the time in 2001? That was fairly early. In fact, I'm not sure we were using, or we were just starting to use the high hyaluronic acids that we use, and we're gonna talk about that. Yeah. But what did you know about it at the time?
Nothing. I knew nothing of it. That was before the Real Housewives started, that franchise. And I just knew that celebrities were doing it. And I worked at a high-end retailer, and a lot of the ladies there had gotten things done, had a few things done.
Okay.
And so I started asking clients and asking people, and they would drop Dr. Mendelsohn. And so that's how I learned about you.
Well, good. Well,
yeah.
I'm glad you did. So around that time, you also, when did you start with Botox?
I wanted to start when I first came to get my lips done, but you were like, no. You were like, because I didn't have any wrinkles. I was too young. But you finally, because I asked and asked and asked, and you finally gave in, I would say about 25. And you still told me that it was way too young and that I didn't need it, but I was persistent, and you gave me my first Botox treatment.
So back at the time, I think we all believed that 25 was probably too young. These days, it's used more as prevention, and of course, it's a whole different world in terms of what we're doing. Where did you have Botox at the time?
I wanted it to I wanted it to change a little. I wanted to make myself look a little more awake. And so you did this really cool, like a horseshoe style on my forehead. So you went kind of high up in my widow's peaks and kind of dipped down, and it gave my brows a lift. And so I thought that was so amazing that you could actually kind of give yourself a temporary eye lift.
A little non-surgical brow lift, yeah. That's right. So it's used in the forehead, and that's where we treat it, and you're right. So just while you brought that point up, let me just explain. We're going to talk about how Botox works in a moment, but it's not where we inject the Botox, it's where we don't inject the Botox generally. So let me just explain this real quickly. So that horseshoe shape, that kind of U shape that Josh is talking about, we're treating more in the central area here, and it's inactivating these muscles. We'll describe this more in a moment. But where it's not inactivating them is out here, and so these muscles allow the brows to go up, and so we can achieve a non-surgical brow lift. But Josh, one of the things that I always got a kick out of is so we treat you with your Botox. I don't know. I see you 3 weeks later. No, maybe 2 hours later. I'm not sure. But at the time, a lot of people. Botox wasn't actually FDA approved at that time. It was 2002, where it was, but not for this region.
Okay.
And so. So we've talked on other shows about it's kind of secretive, right? You kind of have this thing, you look good, nobody knows what's going on because a lot of people weren't using it that way. But you were one of those people, I think I still tell stories to patients that besides your brows going up, I don't think you wanted much movement, at least at the time. And so you would fight whatever you could do. If there was a little bit of movement, we would see you back in the office and we're treating you. For most people, I want to be careful here, but for most people, well, at the time, many people were like that. Today, because of high definition TV, 4K, whatever, you can see, news anchors who have unnatural appearing Botox. So most people will use that as an excuse not to try it because they don't want to be completely paralyzed or inactive. But I do get a kick out of that. So I just want to say to our listeners and viewers, Botox should always be used to try to make you look more natural. That is the goal. In Josh's situation, he looks great, he looks natural, so that's not that he doesn't look natural, but we're not trying to inactivate every single muscle fiber when we're doing this, generally.
I really wanted to freeze my youth. Okay. I wanted to freeze myself.
I like that.
Yeah. So that's why I think I kept coming back. Okay. Anytime I felt a little movement, I was like, oh no, right. No.
Yeah, well, you left an impression, so... So tell me, with regards to maybe at the time, 2001, compared to now, any conversations with women versus men, or I should say men versus women, in terms of having Botox or injectables done?
Oh, yeah. Yeah, I mean, it's definitely, and speaking about early on in the early 2000s, people did whenever they found out, because I was definitely proud to get injections and Botox, and people were scared. They were like, oh, why would you put that in you? Mm-hmm. But I don't know, for some reason I trusted you. I really did. You have a way about you. And I don't know, I just figured that if celebrities were doing this to themselves, well then it couldn't be that bad.
Okay.
So
what do you think it took so long for men to catch on?
I think it was just they thought it was, I have some guy friends that I think I definitely helped them understand what it's for. So men also want to look young. I think they were just intimidated by it, and I think that they thought it was just for women. A lot of times, it can feminize a face. Mm-hmm. Now you can see you get Botox in your jaws to thin out the jaw to make it more feminine. So I think men in the beginning thought it was just a ladies' treatment.
Gotcha.
And then as it became more and more visible on TV, and and then people like myself started getting it done, so it made it a lot easier, to where now all of my male colleagues, they do it on the regular.
Just more acceptable in general.
Yeah, it's a normal part of...
So, Josh, do me a favor. I would call you an expert in this area. I think you know what you're talking about. Maybe if you could help share a little bit for those that don't know much about Botox, or who are afraid of it or don't know what it is. Let's talk a little bit about, first of all, where is it used commonly? Where are the most common areas? Go ahead. I'm going to ask you a bunch of questions here, and I'm going to let you do the education here.
I'm a makeup artist part-time, and so the number one place would be frowning. Ladies, even men will complain, that they have what we call the number 1 or the number 11 between your eyes. And then definitely crow's feet. So over years and years and years of repeatedly smiling and squinting, it can give you those, lovely lines across the temple. Mm-hmm. So between the eyes, definitely the whole eye area, I would say, is
important. Yeah.
Is super, yeah.
The other area is commonly, as you know, your forehead. Mm-hmm. So in the upper third of the face is a good way to remember. So frown line, forehead creases, and crow's feet are the most common areas where Botox is used. You already mentioned that it can be used in the masseter. Some people might grind their teeth. They might have headaches from that. So the masseter or the temporalis muscle. I'm not sure if you are aware, but it's been used for many years for voice disorders, something we call spasmodic dysphonia. It's used for migraine and tension headaches. It's used for what's called spasmodic torticollis, contractions of the neck, back spasm, bladder spasm. It's also used for something called hyperhidrosis or excessive sweating. So it's a medical therapy in many of these situations, and as I mentioned earlier, back in 2002 it was officially FDA approved in the frown line area. Now it's approved in all three areas. Tell us a little bit about the treatment. What does it consist of in terms of going in for a treatment? What is it? How do you prepare? What do you do? How long does it take?
Zero preparation. You can get up, have an appointment any time of the day. any time of the week. It's easy, I would say, from the time, if your appointment's at 10 o'clock, you're seen right away and you're done by 10:30. That's if you probably had every site injected.
So it's pretty quick.
It's super quick. And I would say on a pain scale, if you're a normal person, a pain scale from 1 to 10, I would say it's probably like a 2. It's the smallest needle.
Right.
So it's just a teeniest little prick, teeniest little sting. And but it is the reward is worth it. It's so, to have that wrinkle disappear literally, which that's the coolest part with Botox, is that you see that the wrinkles soften and just disappear. They'll tell you it might take 5 days. For myself, I can tell it relaxes the skin itself. It almost makes your skin tight. Mm-hmm. It's like a tightening treatment. Mm-hmm. And that happens within probably 24 hours. You'll start to see. Right. Yeah.
So Josh was just saying a couple of important things. So the treatment itself doesn't take very long. I mean, literally, it's several injections. You walk out. You may have potentially. There's always a risk for some bruising, of course. And if you're a Botox user along the way, you're going to end up with a bruise somewhere here or there.
You guys do such an amazing job, though. You take your time. You do your best with avoiding those blood vessels that can cause bruising. So I would say, out of, I don't know how many times I've had it done, quite a bit, very minimal bruising. And right. Nothing that you can't go to work to, you can easily cover it up. It's never like a right. giant bruise,
Yeah, so that's true. You'll hear stories about patients maybe around the eyes where somebody's been treated somewhere, and everybody's injecting Botox these days. So you want to be careful. But that's a common area where we'll see patients come back with bruising if things haven't been done as well as they could. The onset of action is what you're talking about. You said it takes about 5 days, and generally speaking, 3 to 5 days, 3 to 6 days is pretty common. That is, you'll really start to see the benefit. You'll have the full benefit. It can take up to 2 weeks. There is a new product. I'm not sure if you're aware of this yet. It's called Jeuveau. It was recently FDA approved, and we've been using it now. They claim that there's earlier onset of action for people who might have a party tomorrow night and they need their fix. Okay. Some of our team already and some patients have experienced that. I haven't yet. They also claim that it lasts longer, the duration. Oh. With Botox, the first time you're treated, it probably lasts about 3.5 to 4 months-ish. Mm-hmm. With you, it might be 3.5 to 4 hours. I don't know. Yeah. But as you use it more, it's usually 4 to 6 months. It goes for longer periods of time. I shouldn't say that. Yes. The truth is, the longer you use it, those muscles are more inactive. It actually lasts longer. So I'll stop picking on you there. But what I'd like to do, let's do this. I'd like to take a look at, and I can probably have you answer these questions, but I'm going to say a little bit about something as we review this animation. This animation's from something called understand.com, and Botox is derived from a bacterium called Clostridium botulinum. It's a bacterium that, if you develop botulism, you'd be infected with this bacteria. That's not what we're injecting. We're injecting a purified protein from this organism called botulism toxin type A. And so in this animation, you'll see that this patient's frowning, and there are 2 sets of muscles there. We call these the glabella lines or creases, and one is the procerus muscle. It's that vertical muscle here, and the other is this horizontal muscle called the corrugator. And this is the main muscle that we're treating when we're treating the frown area. So what you're seeing here in the animation is when I say, Josh, go ahead and frown, you frown, you're activating those muscles by triggering this nerve here. And Josh, do you know what's released at the synapse here? I'm going to quiz you here. Do you know what the neurotransmitter is?
Should I know that?
No, you shouldn't,
okay.
but I just thought you would. It's called acetylcholine, as it says right there. So acetylcholine goes from the nerve to the muscle, contracts the muscle, and there you go. That happens all day long with all sorts of things that we're doing. So after a Botox treatment or other neurotoxin, I mentioned Jeuveau, Dysport, Xeomin are other neuromodulators, neurotoxins. So you can see here in the schematic that Botox is injected, and what's happening is now the acetylcholine isn't released, and it doesn't make its way across the synapse or the neuromuscular junction, and therefore we are selectively paralyzing or temporarily inactivating muscles that we want to inactivate. And this really works beautifully, all over the body. Obviously, we talked about the face. This is why it works for tension headaches. This is why it works for spasm, bladder spasm, back spasm, is because we're reducing some of the stress in a way and the activity of that muscle. We've talked about, its duration a little bit. We've seen a nearly 900% increase in Botox since about the year 2000. Okay, so in men, and that's pretty significant. We're never going to catch up to women. Last year there were about 450-ish thousand men treated, but there were over 7.4 million Botox injections. So it's obviously probably the most popular cosmetic treatment. We had another guest on who talked about Botox and talked about it being an extension of skincare. Mm-hmm. And that's really kind of where it's positioned. It really is about that. Today, if you were 21 years old, 25 years old coming in, we might counsel you differently. We probably would be more engaged in preventative measures and suggesting that if that's your goal. So you were just ahead of your time, Josh. So
that's the trick.
Which
start early.
It is a trick. Earlier. So it's prevention. So here you are. Here's a shot of you coming in, and you talked a little bit already about the treatment. I think this is Karen Whitney, who's performed tens of thousands of treatments in her career. She does a beautiful job, and so does the rest of our team. But tell me, right afterward, are there any restrictions? So I see Karen injecting you here. When you leave the office, is there anything you can't do or shouldn't do?
Yes, you don't want to do anything too vigorous. You don't want to probably go to the gym and bench press. But going on a nice leisurely walk is okay. Doing basic, go to the movies and maybe have lunch. That's what you should do. Nothing too
sounds
insane.
Good. So it's a day out. It's a day out with Botox.
It's a day out. Just relax.
So Josh, how would you say Botox has affected your life so far and moving forward into the future? How do you think it will be part of your life?
Well, you definitely look. Normally, I look a lot younger than other people my age. So when you go home, if perhaps you don't live at home, when I visit, they often will say I look amazing or I look young. So it makes you look younger.
Okay.
And it actually helps you, I think, live a happier life. Studies have proven if you look at yourself in the mirror and smile, it'll make you feel better. So with Botox, you're not able to frown. So studies have even shown, I think, lately, the studies have shown that Botox does make you happier.
You are
right?
correct. Yes,
yeah.
you are quite the student. Yeah, you're the expert. That's true. And I'm not sure if it's the biofeedback from frowning actually, but you're right. It reduces. They've been studies showing the reduction of depression, and people are happier. You're absolutely right about that.
So definitely, I feel more confident. You don't have wrinkles. You feel younger. You look younger.
I want to mention real quickly, we talked about areas that Botox is used in terms of muscle, and there are people who use Botox for, I mentioned a term, hyperhidrosis, and I just want to throw it out there so that we cover it. Hyperhidrosis is excessive sweating. That can be anywhere. It can be anywhere around the body. Commonly, it could be on axillary, under the arms, palms, soles. And you say, well, geez, how does Botox work in those patients? Well, remember that neurotransmitter we talked about, acetylcholine. It also goes from the nerve to the sweat gland. So by blocking the acetylcholine at that synapse, in that location, we can also reduce sweating. So that's how it's used. Some people who might sweat in their scalp or on their forehead benefit both ways. They benefit both by the reduction of the muscle movement as well as the sweating, the perspiration in that area.
Can you, I've mentioned this treatment to some people that have this issue. And they are like, well, that's not healthy to stop your sweat glands, to stop that from happening. Can you explain about how many sweat glands a person has?
Yeah, there's probably 4 million sweat glands. You're absolutely correct.
Right.
And there's actually another treatment besides Botox called Miradry that we use, which really changes lives permanently. You can reduce the sweat glands in that area. They're FDA approved, it's safe, it doesn't create any problems. And so sometimes when I hear that, objections like that, it's true. People wonder, and it's reasonable to worry about things like that. You probably should. But Probably there's also some other concern that those individuals have about why they don't want to do it and what the real fear is. And so sometimes I'll just ask, is there anything else that bothers you? So if you're out there addressing these concerns, you might want to ask the same thing, and then you can educate them as to really how it works.
Nice.
And now you know about acetylcholine, so that's good. Okay, Josh, we'll stand by here. We're going to check out what Julie has to say and what's in, what's out, what's hot, and what's not in plastic surgery. Julie?
Growing young together and plastic surgery date nights in this special Valentine's episode of what's in and what's out and what's hot and what's definitely not in the world of plastic surgery. I'm your guide, Julie Whitney. Get ready as we tour the world and search the headlines to help you become a younger you. It's officially a trend now. Instead of growing old together, couples are choosing to grow young together. Reports from around the country tell of couples who are electing to undergo cosmetic procedures simultaneously. Instead of a trip to the beach, they're taking a trip to the plastic surgeon and loving it. It's true that couples' plastic surgery is on the rise, largely due to the fact that many men see how attractive their wives look following a cosmetic procedure and then decide to take the plunge themselves. According to the ASPS, men accounted for 13% of all cosmetic surgical procedures in 2018, and for 8% of minimally invasive procedures such as fillers, Botox, and lasers. And why not enjoy the benefits of plastic surgery with your partner? Couples are supporting each other and sharing the excitement of looking younger and are feeling more vibrant after their procedures. And I think you know where this can lead. You see, plastic surgery isn't just about me, it's actually about us. Couples want to look good for each other. Now, isn't that a romantic thought? And interestingly enough, the couple's procedures vary by age. In the case of 20-somethings, the woman often comes in for Botox or fillers, and the husband or boyfriend comes in for support. Then he decides he needs a little bit of prejuvenation as well. 30-somethings are often dealing with two major life events: the changes that come with pregnancy and the changes that come with age. This is when women are typically seeking the mommy makeover, which can include breast augmentation, tummy tuck, and liposuction. And when dads are seeking the dad bod do-over, or more definition in the abs, which can also be done with new M-Sculpt. 40-somethings are not quite yet in facelift territory, but they need a bit of refreshing up as they are often in the prime of their working years. This is the ideal time for a liquid facelift using Botox and fillers, and also a very popular time for blepharoplasties or eyelid lifts, since the eyelids tend to show aging earlier than the neck or lower face. The 50s mean an AARP card, a colonoscopy, and often a couple's facelift or neck lift as celebration of being empty nesters with college tuition behind them and plenty of time to gift one another and live life to the fullest. And of course, the 50s are often the decade where women often see many hormonal changes. And the advanced Wow Shot is a painless, quick injection that produces effects such as more intense and frequent orgasms, greater arousal and increased sexual desire, increased lubrication, and reduction or elimination of urinary incontinence as an added benefit. Now, wouldn't this be a nice Valentine's gift for both of you? And according to Dr. Julius Few, a board-certified plastic surgeon and clinical professor at the University of Chicago Pritzker School of Medicine, many couples are using plastic surgery as a date night. Couples are coming in together to double their procedures. Talk about a dream date. And speaking of dream date, a real-life Barbie and Ken have taken their love of couples plastic surgery to an entirely new level. Anastasia Rezkos, age 20, and Quentin DeHar, age 23, of Gay Paris, have undergone 15 plastic surgery procedures to look like their idols, Barbie and Ken, spending more than $300,000. The list of surgeries includes 2 boob jobs, 4 nose jobs, lip injections, butt implants, cheek fillers, ear reshaping, Botox, eye bag removal, fake tanning, teeth whitening, nail extensions, and veneers. And they're apparently still not through with their transformations. And since they've spent all this money, they're undoubtedly living in a cardboard Barbie dream house and driving a plastic pink toy Corvette convertible down the Champs-Élysées. So if you and your Valentine Want natural looking, voluminous, kissable lips that don't look like fake Barbie or Ken? Look no further. Advance is offering special pricing on fillers at 20% off the entire month of February. Just call 351-FACE and make your appointment. Well, that's it for today's news in plastic surgery. You can see more of my plastic surgery journey and also follow your beauty by going to 351face.com. Why not sign up for a younger you today?
That is it for today. Thanks for tuning in. For this and other episodes of Follow Your Beauty, please go to 351face.com/Follow Your Beauty. Feel free to sign up, log in, schedule a complimentary consultation. We're happy to help any way we can. Josh, thank you very, very much. We look forward to having you back. Thanks for all your expertise.
Thank you.
We hope that you tune in next time for another segment of Follow Your Beauty live from Studio A at Advanced Cosmetic Surgery and Laser Center.